All right, so I know we're gonna have quite a few that keep joining on, but just make sure that you do go and put in the chat where your name and your location. And so I'll go ahead and get things kicked off tonight. This will be the first webinar of our winter webinar series through the NC Small Ruminant Working Group through NC State Cooperative Extension. So we'd like to welcome everybody. Tonight's main focus is going to be on animal health and mainly catered towards our small ruminant sheep and goats. And so we've got three really good speakers lined up for you tonight that all have quite a bit of experience, and they have that experience in different facets of their career, which is pretty exciting for all of us. And so I'm going to go ahead and real quick let introduce all of our agents and specialists that help put this on, that are part of this group that are getting this started. I'm Brandon Hartman. I'm the livestock agent here in Rockingham County, North Carolina.
I'm Adam Long. I'm the livestock agent in Randolph County, North Carolina.
I'm Andrew Weaver. I'm the small ruminant specialist here at NC State.
Johnny Rogers, coordinate the Amazing Grazing Program at NC State.
I think that's all we have on at the moment, unless somebody's slipped in here without me seeing. So I don't want to take up too much extra time to let us get started, but those of y'all who might have been added, make sure you do go and put your name and location in the chat box. And we're going to go ahead and get started with Dr. Scott Bowdridge. He's a professor at West Virginia University, and he's going to discuss internal parasites and some of the factors concerning that. So, Dr. Bowdridge, I'll turn it over to you. And I'm not sure if you're trying to talk right now. You're still muted.
We're supposed to be good at this thing, as being in academia and doing this all the time, but I just got game time jitters. So give me a moment here. All right. Well, let me do this. Good. Okay, so thank you all for having me. I don't think that many people have small ruminant health talks anymore without at least having a parasite talk thrown in there somewhere. So today what I'm going to just introduce the idea of is selecting for parasite resistance. If you haven't seen this stuff before, and if you have, it might be a renewal to all that stuff. But I think that there's some interesting things that happen when we select for parasite resistance that we never expected. So we're gonna kind of explore that. But before we get into all of that stuff, we've got to go back to some of the basics and talk about some of these gastrointestinal nematodes that are affecting sheep and goats that we'll see out here. So the ones that we're primarily focused on are in the abomasum, and that's Homunculus contortus. So that's the barber pole worm, Teledrossagia circumcincta, or the brown stomach worm. Then we have other worms that affect the small intestine and large intestine, but mainly we're going to focus on this guy right here, Homunculus contortus. So you all have heard about this, and Homunculus and many of these other species have a very generalized and simple life cycle. Sheep or goats are going to eat those infective L3 stage larvae off the pasture. Those larvae are going to migrate with all the digesta through the compartments of the ruminant stomach and land in the abomasum, or finish and stop in the abomasum, where they'll become adults. So those larvae in about 14 to 21 days are going to develop into adults. Those adults will mate and start producing eggs in the environment. So then in the environment, those eggs are going to develop into L1 stage larvae, L2 and L3, and then move with moisture up and down plants or blades of grass to be consumed by the host. So this is just a better image of what Homunculus looks like in the abomasum of a sheep. You can see where they get their barber pole name. You see that their stomach on the females is twisted around their ovary, and their stomach, because they're feeding on blood, is red, and their ovaries are white. So it gives them that barber pole appearance that you can see in this lovely video that's occurring right after dinner time. So how are we controlling these parasites? Well, typically we've relied heavily on anthelmintics or dewormers. And in the United States, we only have 3 drug classes to use for our choices for dewormers. So the benzimidazoles, or the white dewormers, would be drugs like Valbazin, Safeguard, Panacur, or Synanthic. The neonicotinoids are the ones that I hate to pronounce that way. Things like Prohibit or Levosol, Ruminant, things like that are evolved. If you've been around sheep production or goat production long enough, you remember the old TBZ pellets, so that we used to have to bolus sheep with. And then finally, we end up with the macrocyclic lactones like ivermectin or doramectin, Sidectin, and Eprinex. So these drugs have all been developed and will all work great when they started. But what's happened over time is the development of anthelmintic resistance. And this is why parasite problems become more challenging anywhere in the world. So resistant worms just accompany host. So they've always been there. The anthelmintics remove the competition of those parasites. And actually, worms that become resistant to some of these dewormers, like, for example, worms that are resistant to the white dewormers or benzimidazoles, are larger and lay more eggs. And here's the thing that you need to know about this, is that once worms have become resistant to drugs, they never lose those genes. While they may not be selected for heavily, they'll always reside within the worm population. So you're going to have to consider once resistance, always resistant. We've got some variation with this, though. Levamisole resistance is sex-linked, so you can revert to a susceptible population. It can revert. It's going to take several generations, but the generation interval on worms is actually pretty short. So that works in our favor on doing this. So where do these resistant worms come from? Well, oftentimes I say that they're purchased, right? So we can talk about that a little bit, but there's a lot of genetic diversity in parasite populations, and they have to be that way. Homunculus, for example, if you've got a female worm, she's going to lay 5,000 eggs per day. If you've got 300 female worms in an animal and 30 animals out there in your pasture, they're putting out about 1 billion eggs every 3 weeks. So each one of those eggs has the potential to develop into larvae and infect other animals that are coming through. And this is the great thing about this. Resistant worms actually existed in population prior to drugs even coming online. So it's one of those things where this is something that we're always battling. And how do we battle this, and how do we use anthelmintics to actually work it a little bit better in our favor? So we have to think about this concept of refugia. And the refugia is just a set of worms that have not been exposed to dewormer. And put it in another way, it's animals that weren't treated with dewormers. And a lot of you may say, why would you not deworm some animals? And it's simply put, it is the way to keep worms around, or worms with genetics, for susceptibility to drugs. So when we use drugs, we have to become parasite selection experts. And from an animal breeding perspective, every time you deworm, you're going to change the parasite population. Susceptible worms are culled, and the resistant worms are kept. So that's why we want to have some animals around that are still, that are not dewormed, so we can maintain the genetics of anthelmintic susceptibility within the population. So the only way to keep susceptible worms in the population is by not deworming. So how do we make that not deworming decision? I think that we're very fortunate in the small ruminant side of this to have something that was developed in South Africa many years ago, is the FOMACHA eye color scoring chart. This just simply measures, it's a shoot side measurement of anemia. It at least gives you an idea. of anemia that would be associated with particularly Haemonchus contortus infections. So by using this chart, we can identify animals that don't need to be dewormed, that are a score of 1 or a 2, and animals that may need to be dewormed, a score of 3, 4, or 5. So it's a really simple classification that we can do to manage these types of parasites. So we talk a lot, and you're going to hear a lot about managing anthelmintics and managing dewormer resistance and managing parasites in general from a lot of these extension workshops. And I think one of the best tools that we have for managing parasitism is selection of sheep that are resistant to parasites. And a lot of us are familiar with some of the breeds that are floating around, particularly in the southeastern United States, with the Katahdin breed. And they are very popular in this side of the country and actually spreading out to the West Coast. And we're starting to see some Katahdin sheep out there. We're seeing Katahdin sheep in Texas. So we can select Katahdin sheep and we can select other breeds using breeding values that are calculated by the National Sheep Improvement Program. So what is the outcome of selection for parasite resistance? So if I take sheep and select them for this breeding value, and the breeding value would be negative, right? So if they have a negative breeding value, that means they're more parasite resistant. If they have a positive breeding value or high fecal A count estimated breeding value or high FEC, you can see that lambs on pasture, when we infect these, or when these Katahdin lambs are infected on pasture, the low fecal A count breeding value lambs have lower fecal A counts. And the high fecal A count breeding value lambs have high fecal A counts. So selection for this particular trait works. It's very effective. It even translates into the feedlot. We get differences between those groups, and it all works. And the reason that it works, particularly in Katahdin sheep, is a part of their heritage. Now, I work specifically with a breed called the St. Croix, and they look a lot different than Katahdins, right? So one of the main breeds that was used to generate Katahdin sheep back in the 50s and in Maine when Michael Peel was developing the breed was the St. Croix sheep. And this is one of the reasons why. So if we look at these sheep, these are St. Croix lambs, naive lambs who had never been infected by worms. Their entire life were grown in a worm-free environment. The first time that we infect a set of those naive lambs, their fecal A count goes up to about 3250, and then it drops the next week. That's not due to anthelmintics. It's not due to anything else but the animal's ability to generate an immune response to the parasite. If I take those same lambs that got a primary infection and we deworm them, even though we're all the way out here, we deworm them anyway. And we rest them for 2 weeks and come back and give them another 10,000 larvae. The challenge infection results in no fecal A count. This is what host protective immunity looks like. So when we're selecting for fecal A count, we're actually selecting for immunity to parasites. So we're selecting for an animal's ability to generate an immune response to this adult and larval stage and egg stages in generating all of these things. And I don't want anybody to feel overwhelmed by all of the alphabet soup that us immunologists deal with, but it's all of these things that are happening in concert that are able to clear the infection in that animal. So I think, post-COVID or even during COVID, we all kind of became armchair immunologists. So some of these words you'll see, and you'll even see in drug ads on commercials with eosinophils or mast cells or degranulation of those or histamine. That's all a part of this response to this parasite. Different antibodies that are produced in response to this parasite. So this is what's actually causing the lower fecal A count in these sheep that are selected for parasite resistance, is that they have a more enhanced immune response to that parasite. So how do we measure generalized immune competence? So are these animals that we've selected for parasite resistant just generally more immune competent? And one of the ways that we looked at this at WVU and in collaboration with Virginia Tech is we started a divergent mating project in 2017 in Glade Springs, Virginia. So in the first year, we just used sire alone. So these were lambs that were sired by either low fecal A count rams, so their fecal A count EBV was as low as you could possibly get it. And on the other side, we found rams that had extraordinarily high fecal A count breeding values, meaning that these Katahdin rams were susceptible to parasites. And what we see here in terms of this death loss in the first year in 2018 was about a 20% difference in death loss in those lambs that had nothing to do with parasites. These were death loss due to clostridial diseases, pneumonia, foot rot, you name it, any way a sheep would want to kill itself, it found it. And the lambs in this group tended to find it a little bit more frequently, or quite a bit more frequently than the lambs in this group. If we go to these years coming out, this first year we had an outbreak of Clostridium type A. Dr. Fletcher diagnosed that when they were there, and they were seeing this kind of impacting lambs in this part of Virginia and calves in this part of Virginia, and they vaccinated the next year. So we go from 29.9 down to 11.5. We still maintain a difference. That difference, since we've been doing this, so we've been doing this since we started the first mating in the fall of 2017. Our first lamb crop was in 2018. From 2020 out to this year's lamb crop, we've seen that divergence in lamb survivability to weaning. So that is one way to actually look at immune competence. So it looks like death loss in divergently bred Katahdin lambs favors lambs, or we don't see as much disease in lambs that are more parasite resistant. We've looked at this in terms of culling based on mastitis incidence in Katahdin ewes, where we looked at culling based on mastitis. The low fecal A count EBV ewes have a lower incidence of mastitis or as a percent of the ewes lambing. So we're looking at culling at about 2.2% for the low fecal A count EBV ewes, whereas on the high ewes we're up here around 12.5%. So what is the outcome of selection for parasite resistance? I think it's improved immunity to pathogens other than worm parasites. So when you select for fecal A count breeding values, what I'm hypothesizing is that you're also improving generalized immunity. The animals just simply have a better immune response. So to prove this even further, there's something that we do to lambs every year. And every time they're born, and as a part of their production system, is that we will give them a vaccination. And one simple way to prove that animals have a better immune response or ability to generate an immune response is to evaluate that in respect to their response to a vaccination. So we took these three low sires and mated them to low ewes, and 3 high sires and mated them to high ewes, and managed all the lambs together as one group. And you can see what these values look like. This was all before any genomic adjustments occurred on the breeding values of the Katahdin sheep. And we collected fecal samples and we collected blood samples when they got their first vaccine, and then when they got their booster vaccine that occurred right around weaning. And then we did this for another 4 weeks after weaning. So what we see in the fecal A count of the low lambs versus the high lambs is that the low lambs have a lower fecal A count as expected, because we've already shown that selection for fecal A count breeding value lowers the fecal A count in those lambs. But what we didn't expect was the fact that low bred lambs generate more antibody in response to vaccination. And in this case, what we see, so right here we get a little bump in those lambs' antibody production, and then right after this booster vaccination, a week later, they shoot up. So the low PFEC, or the low fecal A count estimated breeding value lambs, have a increase in the amount of antibody that is produced in response to vaccination, which may in part explain why those lambs are surviving better to weaning. So what's the outcome of selection for parasite resistance? We've got improved antibody response to clostridial vaccine. So do Katahdin sheep with lower post-weaning worm A counts or fecal A count EBVs generate just more antibody in general? And one of my students came up to me and said, Doc, I want to look at this in colostrum on ewes. And so the first year we did this, we tried to find the most extreme values in the ewe flock that was down at Glade Springs, Virginia. So we took the colostrum from those ewes in the jug within the first 12 hours after lambing. We looked at it 30 days after lactation, and then we looked at it 60 days after lactation. In the second year, I got to tell you, the data that we found was so dramatic. In the second year, we decided to do everybody. We just dropped this idea of evaluating the extremes, and we did everybody. So in the second year, what we did was we grouped them by their fecal egg count breeding value. So the low group had was less than -50 on their breeding value. The mid group was -50 to +50, and the high group was greater than 50. And you can see that we have pretty close. I mean, we just don't have as many of these ewes around as these ewes, but that's what we had to work with. So if we look at, I'm going to show this first. We look at the average immunoglobulin, or the antibody that is there in dialyzed milk samples across year. You can see that the low ewes, no matter what year it is, they're producing more antibody in milk or in their colostrum than what we're seeing out of the ewes with the high fecal egg count EBV. Then when we did this in year 2, remember that we had those 3 groups, the low, the mid, the high group, and we're getting this kind of stepwise decrease in the amount of antibody that's produced in these ewes. We're not feeding them any different. They're all middle-aged ewes. They don't keep a lot of old ewes or really old ewes out there. So they're all that kind of most of them are that 3 to 6 year old ewe age. There's some yearlings in there as well, but they're still doing this. So these low ewes are generating, I mean, this is a 2.5-fold increase in the amount of antibody. And if you don't think that that sets that lamb up for kind of survivability all the way through weaning or the rest of their life, it's just wrong. I mean, having that much more antibody in colostrum is giving that lamb 2.5 times more protection against a variety of different diseases. So this isn't antibody specific to any worms or any particular pathogen. It's the total amount of antibody that's present in that used colostrum. So we've got a 2.5-fold difference between low and high ewes. So remember, this is just selection for fecal or for parasite resistance, but we're getting these other traits that are coming along for the ride. So let's talk about this. And so what's the outcome of selection for parasite resistance? We've got lower fecal egg counts. That's going to give us greater parasite resistance. We've got reduced death loss to weaning, greater lamb survivability. I think that we're all in favor of having more lambs to survive to weaning or more kids surviving to weaning. That's more animals that we can sell. We've got a lower mastitis incidence in brood ewe. That's going to affect the ewe longevity and how long those ewes are active in your flocks. Greater antibody response to clostridial vaccine. Well, let's go back to number 2. If those lambs are generating a greater antibody response to that clostridial vaccine, then they're probably going to have a reduced death loss to weaning. Greater colostrum IgG production, see number 2 again. That's going to give those lambs lifetime protection. And I think that, not lifetime protection, but it influences their ability to survive or their longevity in general. And that's what they've seen in the dairy industry and the beef industry by looking at colostrum quality and its effect on lifetime performance in those animals. So that's my short spiel. I wanted to stay within my 30-minute time limit. None of this work is possible without a lot of our participants and collaborators and the group of students that I have at WVU. I'm going to turn it back over to our session moderator and go from there. Thank you all.
All right, I hope y'all enjoyed that first section. Like I mentioned earlier, make sure if you haven't yet, put your name and where you're joining this Zoom call from, just so we can sort of see how far our reach is today. We appreciate it, Dr. Bowdridge. There's a lot of information packed within that 30 minutes right there.
So I'm going to stay around. I'll be here for questions at the end.
Good deal. We're going to have quite a few. We're going to make sure we've made sure we're going to leave plenty of time at the end for questions. But throughout, if you think of a question, feel free to drop it in the chat box. And we'll make sure that, and that way you can document it, and we can make sure that we get to that question at the end. So our next speaker is going to be Dr. Chris Fletcher. He's a vet with Virginia Department of Agriculture, and I'm going to turn it over to him. He's going to be discussing general health, especially related to sheep.
Thank you, Brandon. And Dr. Bowdridge's presentation was a great segue to what I'm going to be talking about here this evening. And I appreciate all y'all taking time to join us tonight. Just a little bit about me, just so you'll know. I just recently have taken a job with the Virginia Department of Agriculture. But for the last 16 years, I have been in private large animal mobile practice. So feel free, at the end, any questions that I can help anybody with, I'd be more than glad. And we've got a great lineup. If I don't know the answer and they don't know the answer, we'll try to make up an answer. So, so I'm going to be talking about sheep diseases kind of in general, and we'll just be kind of skimming the top of the icebergs here. Not any one of these will be kind of in depth too much. So, of course, we all know that sheep want to do two things in life: escape, which we can do a little bit about, and then die. So hopefully we can deter that situation too. So like I said, Dr. Bowdridge's talk was definitely a great segue, because when we're talking about sheep diseases, as far as a practicing veterinarian, by far of the cases that I saw, 90% of them was across the board was related to parasites. And a lot of this says sheep, but you can transpose the word goat there also. So small ruminant diseases, 90% was definitely from parasitic issue. These other ones probably, to be honest, probably fall in that 10% category. However, they're big issues, and if you have one of these hit your flock or herd, it feels like more of the 90%. But overall, in general, they're a little further down the list than parasites. And we'll be just going through these just a little bit. So, refringents, like Dr. Bowdridge had alluded to, we've in our area, Southwest Virginia, Western North Carolina, Northeast Tennessee, we've had kind of a uprising of Clostridium perfringens. So Clostridium's in the blackleg family. If you've got cattle, most producers have heard of the disease blackleg. All the Clostridium bacteria are gram-positive anaerobes, meaning that they only survive in a lack of oxygen environment. And Clostridium perfringens is a normal inhabitant of the GI tract. However, one of the interesting things is, it has the shortest generation time of any bacteria. So within a little over 6 minutes, this bacteria can generate into a population that can potentially kill the animal. The Clostridium in humans is responsible for a lot of the human food poisons. As with most Clostridium bacteria, it causes necrosis and a gas production in the tissue. So the image up here in the upper corner is an image of blackleg, and that's kind of what a skeletal muscle would look like with a Clostridium shovii infection. So Clostridium perfringens has 5 types: A, B, C, D, E, and F. all of these Clostridium perfringens types will cause an enterotoxemia or a blood poisoning, if you want to think of it like that. Type B causes lamb dysentery, or what we call bloody gut, usually in those 2 to 3 week old lambs. And you can get as many as 60% of your lamb crop being affected by type B. Type C and D, which is probably the most well-known Clostridium perfringens, and some people know that they're giving it, but doesn't know the types. But for instance, which we'll get into, C, D, and T is your vaccine, or one of them. So type C and D, typically it's due to people call it overeating disease, which is sometimes a misnomer, but that's what it's been related to, eating excessive amounts of feed, or bottle lambs engorging themselves with more milk consumption than they're used to, any kind of change in rations if we're dealing with feedlot lambs. And then you sometimes can see it in singles stealing all the milk on the ewes. So treatment, and we'll get into this just a little bit later, but this is the only one that actually has a defined treatment available commercially, which is C and D anatoxin, which will be different than your vaccine. Types E and F are rare and doesn't appear to affect animals. So here we've got on the left-hand side is your 7-way blackleg, so mainly used for cattle, but I thought I would show that to you. The center picture here is Barvac CDT, so that is, some people call that a 3-way, so that only has Clostridium perfringens type C, D, and then tetanus in that. And then a lot of people use Covexin-8, which is an 8-way, kind of has the 7-way plus tetanus in that product. But I kind of pulled out Clostridium perfringens type A, like Dr. Bowdridge alluded to. We kind of had an issue and still ongoing. I've seen, as people were telling where they were from, we're kind of got just a whole variety of places across the United States where people are from. Whether this is or is not a problem in your area, but you may want to keep this on the back of your mind just in case that you might see something like this. But typically it has to have the right environmental conditions, from what I've researched, to kind of proliferate itself. But type A, which is what most people call it, normally found in the soil, and like we said before, in the intestinal tract of these animals, or out of a healthy animal, it can still be isolated in it. It's when it overgrows, and that's when it becomes a problem. So with type A, it doesn't appear to have an age factor to it. So this can hit lambs all the way up to mature ewes and does. I say does and kind of hesitate, because not often do we diagnose this in the goat population for unknown reasons. But typically where I find it is only in sheep. So we talked about blackleg hitting the skeletal muscle. Your Clostridium diseases, C and D and A, hits the small intestines, is where that will take up house. So like I said, it causes a blood poisoning. Here is just a cross section of small intestine. You can see on the left, you've got really nice villi, which is where your digestion absorption will come from. And on the far right, you have a diseased small intestine with Clostridium type A. And you can see on the bottom right, those villi are just like cut off at the legs. So you have no absorption of nutrients once this bacteria takes and sets up house. Like I said, most Clostridium perfringens diseases come from a feed change or typically associated with that. Once that pH gets around 6, they grow really well. You can also have an uptake from the ground, especially, if you're typically feed on the ground, they can actually take up that bacteria and increase the numbers in their gut. So if you can, just keep that feed off of the ground. Wet humid conditions also contribute to that. So this is one of those diseases that is not passed from sheep to sheep, although you can have a kind of a mass outbreak type of situation where you can have several deaths, not from sheep to sheep or goat to goat transmission, but everyone got the feed change, the same feed change. So you got that bacteria bloom in their gut. Clinical signs, typically you just find these dead with no good reason. If you're lucky enough to see one still alive, sometimes you'll see abdominal pain because their GI tract is cramping up so much. They can have diarrhea. Typically, with all Clostridium diseases, you get death within the first 12 hours. One thing that I kind of find unique to Clostridium perfringens, the abdomen, if you see them just prior to death or even after death, you get a kind of a bloat type of situation with it. So this goat in the picture here that I outlined, the rumen will set on the left-hand side if you're facing the rear of the animal. So that's your typical bloat. So with this type of bloat, you get a swelling kind of on both sides. So the majority of those small intestines will set on the right-hand side of that animal. Once those intestines fill with gas, it kind of expands up and out on the right side. So here we have a kind of a normal GI tract. Those are all small intestines there. So that's kind of what you would normally see. And this is an intestine that we confirmed Clostridium perfringens type A with, and I'm going to use a veterinarian term here. These small intestines are pissed off. So they're real red, irritated. You can tell that that's just real irritated tissue. So, and that's all filled with gas from the Clostridium perfringens production there. So what can we do? Avoid ration changes, sudden ration changes. Take them up and down gradually, whichever way you're going with them. If you find an animal dead for no good reason, I would encourage you to have a postmortem exam done on that to try to figure out whether it's Clostridium or not. Typically when we find one dead, it's just bad luck. You get number 2, number 3, you probably need to be doing something, more investigation on what's going on. So as I mentioned before, CD&T antitoxin is available. However, it does not work on type A because I've tried it. So it will only work on C and D Clostridium perfringens. So penicillin should be the drug of choice if you do find one alive. So I've got Covexinate, which we already talked about. Vision CDT is just another brand. And I've got Clostridium perfringens type A here, which was commercially available. However, they have let their license run out on that product and no longer are making that. So our only option is to have an autogenous vaccine produced currently. So Hoof problems will be our next section, real quick. When we think about hoof problems, really we're kind of dealing with three major issues here. The first being abscesses, foot scald, and foot rot. So a lot of times I find that producers will confuse these three. If you look at this kind of schematic here, just to orient ourselves, so this is looking at the bottom of the hoof. You've got the toe, the sole of the foot, the heel, and then of course there's one on each side. And between that, you've got the interdigital space here, and that will be important in just a little bit. So toe heel abscesses, usually this is our fault. So it's usually caused by overgrown hoofs, and you get damage to that sole and hoof wall, and then bacteria sets up, and anytime you wall off that sole and dirt and maybe a injury and prevent oxygen from getting in there, you can have a abscess form in that hoof wall. So typically what you want to do is power out that abscess to get some good drainage. Typically 7% iodine works really well. Antibiotics if you think they need it. And I've got a roll of vet wrap here. I like to after I get finished, so powered out, drain, and 7% iodine put on there, I usually always put a wrap on that foot because the hole that you powered out and where the abscess blowed out will, if you just let them go, will pack full of dirt again, and then you're right back to where you started. It will actually re-abscess. So if you can keep that covered to prevent the dirt and excess material packing in that void, then you're going to be much better off. However, make sure that wrap comes off. You don't want to leave that on, because that wrap will act like a rubber band, and you can have an amputation rather than a abscess. So foot scald, this typically has no hoof or sole involvement. So we're talking about the interdigital space alone. So they will still be lame. The bacteria typically responsible for this is Fusobacterium. However, everyone thinks it's contagious, but it's not really contagious from animal to animal. But there again, with the feed situation, everyone is in the same environment. And then that sets up, if we've got ideal conditions, typically wet, muddy, springtime or even late fall, and you get a wet late fall, you can really see this, pitch up into a fit. So treatment, you can, if you have the ability to change the environment, sometimes will help greatly. You can still run them through foot baths, will help. Antibiotics, in my opinion, there's been a little discussion on a forum I'm on whether to give antibiotics or not. In my opinion, Zactran by far is a great antibiotic. It's kind of a one and done type of issue. So, but I myself, I'm not afraid to give these antibiotics. So here we've got our schematic, and that is the area where you're going to find foot scald, just in between those hoofs. So foot rot, and this is the kind of the hush word, but it involves the hoof wall and sole of that foot. These will be extremely lame. This, if you were keeping up, Fusobacterium is still a cause of foot rot. And one thing about foot scald foot scald left untreated can turn into what we call benign foot rot. Bacteroides is the contagious form of foot rot. So you can have both bacteria at the same time. Not typically in life is anything a pure infection of anything. So one of the things about bacteroides, even though that is the bad type of bacteria, it only stays in the environment for about 2 weeks by itself. However, if that bacteria has hoof tissue to feed off of, it can last many months in the environment. So, which if you're kind of thinking ahead here, if you're trimming feet and you've got foot rot, those hoof trimmings that fall off of there could potentially harbor this bacteria. So you can have carrier animals also. So that's where we get into our treatment and prevention kind of groups. You isolate into 2 groups, lame and not lame. Trim all your feet really good. I'm not one to really trim too much. A lot of the kind of the old way of thinking was trim till it bleeds on these hoof rot cases. I think sometimes we do maybe a little bit too much damage by doing that. There again, you see antibiotics. Zactran probably is the best thing for foot rot that I can think of. However, do keep in mind Zactran does have a really long withdrawal time compared to our other antibiotics. So you're looking at around 42 days on a meat withdrawal, which is a long time if you're sitting on lambs to try to get them going. Here we have some pictures of foot rot, and that you can see what I'm talking about. So you get sole and hoof involvement. You can't really see because it's been so chronic and either way, but not a whole lot in the interdigital space. But you can see the hoof itself is just being deteriorated and eaten away, literally. So here we have our schematic, and that's the area that you're going to see foot rot. Our next speaker will probably be getting into this much more, but prevention, I can't stress biosecurity enough. If you've got people regularly coming to your farm and you don't know their foot rot status, by all means, have them put on at least a pair of boot covers. So it can be spread by shoes, truck tires, and new additions. So if you're bringing animals in, they can bring that right into your farm. So trim feet regularly. If that bacteria doesn't have a lot of creases and crevices to set up house in, that will definitely help. Zinpro mineral, I'm a big proponent of that. That zinc really helps and supports hoof health. Mastitis. Mastitis is just an inflammation of the mammary gland. Typically, what we see is strep, staph, Pasteurella, and E. coli. So these can appear lame, especially with the acute mastitis. Their udder will be inflamed and painful. So the first symptom you may see is that your sheep or goat maybe looks like they're lame. But after more investigation, you find that, actually it's not in their foot, it's in their udder. Typically what we see in acute mastitis is the time just shortly after lambing or kidding when we see this happen. You might see them refer or refuse to allow their lambs to nurse. And then in the coliform, or what I call the bad type of mastitis, it will actually cause blue bag because it affects the blood supply to the udder. antibiotics systemically and intramammary. And then these animals will need some non-steroidals such as Banamine to help with the inflammation and pain. So here we've got a couple of examples. The picture on the right is what I'm talking about, blue bag. So that's typically a E. coli or sometimes even Clostridial type of bacteria. And you can see the line of demarcation there where that tissue is just going to fall off. So which is pretty bad. These animals can go septic also. But to be honest, you know, we do see some clinical acute mastitis, but by far as a practicing veterinarian, I have more calls on subclinical mastitis than I did active mastitis. So typically we see this post-weaning. The problem with this is you may not see any clinical signs. So it's kind of sneaks right in and bites you in the rear end type of deal. When you will see it is at the next lambing, because these animals, they lamb or kid, and then, you know, if you're stripping out teats when they come in, you can't get any milk out of them. Or if you're in the lambing jug or something and these lambs are acting like they're starving to death, that's because they are. So what happens in this, they get a low level of bacteria in there, and it actually damages the milk producing cells of that udder and sets up scar tissue. And you can kind of see on this sheep here, kind of lumpy, bumpy texture to her bag. It's not a smooth udder. And that, if you can imagine, that's pretty hard. So that's just scar tissue built up in that udder. So the best way to do this is to palpate the udder after a dry off period from when you wean the lambs or kids, hopefully prior to breeding, so you can go ahead and get those culled out. For us, when we trim feet and have them turned up, you know, anytime you've got the opportunity to palpate and feel a bag, even though they're dried off, so their udder's kind of regressed, you can still feel those lumps and bumps in that udder, and that's a sign that you need to cull those out. So CL or caseous lymphonitis is definitely an issue. It's a bacteria. It actually sets up in the lymph nodes and causes those lymph nodes to abscess. These can be internal or external. Typically, we see external. I don't know as I've, to be honest, ever diagnosed an internal case of CL, but I wouldn't say I wouldn't have missed that either. So the problem with CL is that it's zoonotic, so which means that humans can also get it. It's a pretty hardy bacteria. It can live in the soil and on gates and feeders for up to 8 months. Most commonly, the lymph nodes around the head are affected. However, there's any lymph node area, which I think I've got a picture of, can be prone to CL. These lymph nodes enlarge. If you can see the upper right picture here, that has already lost the hair, and you can imagine that thing is just getting ready to pop. And once it does, this picture here, it's a real thick yellow cheese-like abscess that's in that. Once ruptured, like I said, it's contagious to other animals and also to humans, enters damaged skin. Here with this goat, you can see that is kind of already healed up place there. That means if you find that, you're too late. It's already ruptured and potentially has spread. So to diagnose these is a little tricky. By far the best way is to culture the abscess and get a positive ID on the bacteria. Blood work, we use an ELISA test. The ELISA test detects antibodies. So the issue is they have to have seroconverted in their body to be positive. So we do get false negatives, and then you sometimes will get a suspect and have to go back and retest those. The other issue is there is a vaccine. If they're previously been vaccinated, they will come back positive on that test. Once infected, they're always infected. And you can have reoccurring abscesses also. If you're going to lance these abscesses, just try your best not to let that discharge hit the ground, because that will be can infect other animals. After you do lance them, LA 200 or 300 does really good to get that to dry on up. Isolate and cull those. So kind of new thing for CL is using Draxin. Either inject that directly into the abscess, or inject it in the abscess and give a shot under the skin. And supposedly, I didn't get to try this in practice, but this can resolve that abscess without it actually rupturing to the outside environment. Of course, this is off-label, so still won't cure CL. So by far, biosecurity, like I said before, is by far the best practice. Test all incoming animals, but you still have that possibility of getting false negatives. The vaccine, which is here, it's called Caseback. It is kind of a misnomer. So it actually doesn't prevent the disease or treat it, but it may decrease abscesses from forming. Real quick, I know I'm running out of time here. Respiratory disease, lungworms. Typically, we don't really see a lot of lungworms in this area. More warmer climates, you do. As far as pneumonia, you've got a viral and bacterial component. One thing I did want to bring up on the pneumonia, so if you have a lamb, this P is Pastorella, that has a Pastorella pneumonia, that lamb can transfer that to the ewes udder and set up mastitis. So you may have lambs with pneumonia, which turns into ewes with mastitis. So I did want to mention that real quick. You'll see fever, lethargy, drooling, coughing, wheezy, snotty nose, like a typical pneumonia. Where I saw this the most was with newborns, especially in jugs and mixing pens. And what we see on them wouldn't be any real like outward signs except drooling and the wheezing on these little lambs. So, sorry. Diagnose necropsy and culture the lungs. Treat these with antibiotics, and don't forget about the non-steroidals for your fever and inflammation. There are a few vaccines out there commercially available for sheep, and if you're having issues with that, then I would encourage you to look at that. So here we have a healthy lung on the left, pneumonia type of situation of lung on the right, and you see with this lung, the pink section would be the only real viable oxygen moving section. So this sheep was only running on maybe 10% of normal healthy lungs. So with that, we said we were going to save questions to the end, and I will turn it back over to Brandon, and I'll be on here later if anyone has any questions for me. So thank you.
Well, thank you, Dr. Fletcher. So we're going to go ahead and change gears to goats now. I know Dr. Fletcher's presentation was mainly geared towards sheep, and today we're able to get Dr. Fred Brown, retired veterinarian here in North Carolina, who's done quite a bit of work personally on his own farm with goats, and so I'm going to go ahead and turn it over to Dr. Fred Brown.
Okay.
Did the presentation get minimized?
I'm not sure.
You might just have to reshare.
Okay. Let me get back here.
I saw it up there a second ago.
Yeah, I know, but it got, I don't know what happened to it here. I've got it up on my, mercy. Okay. Sorry.
When you hit the share screen button, what does it show you?
Okay. Hang on just a minute here. Let me get, okay. When I got share. Let me cancel it. Share screen. Then I've got window, entire screen. Before, when I had window, it would show it there, but for some reason it's not picking it up now. I have it up on my computer here, but
Is your PowerPoint open?
yes.
And
Yes,
then when you
my
hit share
PowerPoint.
screen, does it give you an option that shows like a screen with your PowerPoint on it?
Let me see here. See, it did before, but now that I'm up, it is not showing that. Let me get back here. I don't understand. Yeah, that's what you get when you get a rookie on here that doesn't know technology. There you go.
Are you using two screens or just one?
Just one.
Okay. You should be
Well,
able to-
maybe if I click it, if I come up now, does it show on your side?
I'm not seeing it.
You're not seeing it. Okay.
What options does it give you when you click on the share screen?
When I go on the share screen, it's like it's not picking it up from my computer now. It just has Microsoft Edge tab at the top and window, and an entire screen. Oh, mercy.
If you want to email your presentation to
I
one
already
of us,
have a copy of his presentation just in case. So
Brand-
I can go ahead and pull that up and we can go ahead and rolling. Let me get it.
Okay. All right. I guess we'll just communicate and I'll say next, right?
That'll work for me.
Okay. All right. Well, glad to be here tonight. Actually, I am not retired yet. I've been in practice for 31 years. First third of my career was in mixed animal practice. And then the last 2/3 have been in small animal, cat and dog practice. However, I raise Kiko goats here in Western North Carolina. So next. Yeah, this is what it looks like out my front door. So I do live in the foothills of North Carolina. So, all right, we'll move on to the next one. So we're going to talk a little bit. You're not going to hear me talk a lot about specific drugs or drug dosages and that kind of thing, but you are going to hear me talk a lot about management tonight. So just a brief economics here. Profit in our meat goat herds is equal to income minus production cost. So some of the ways that we can increase the profit for our meat goat herds is to either raise income through the increased price of the animals sold or increase the number of animals that we sell. We can also reduce production costs by the increased use of forages, reducing the amount of grain that we rely on. And but we want to ultimately try to, what we'll focus on tonight is some of the management practices that we can use to reduce medical costs. Next. So what is our goal? So of course we'd like to minimize or eliminate death loss in our herds. We'd like to minimize the number of sick animals that we have. And we'd like to eliminate the need to spend extra money on animal health products that we may not need. And we also want to be able to market the most kids with the least possible health care expense. So we'll go on to the next slide. So I think for me, the keys to herdsmanship in a meat goat herd is first of all, I think education. If you're not already into goats, by getting yourself educated as much as possible. I think close observation of your herd, and then management, which is what we'll focus on. And a good friend of mine had this saying at the bottom, that therapeutic treatment after a problem arises is like applying a Band-Aid. And as the level of management increases, dependency on Band-Aids decreases. So we want to try to decrease having to use the Band-Aids. So we want to increase our management skills. So that's what we'll focus on. All right, next. So first of all, we have to recognize the enemy. And this is just a kind of a laundry list. And Dr. Fletcher did a good job of going over most of these things. So I won't go over them in detail, but these are some of the diseases, if you have goats, that you are likely to encounter. Of course, as Dr. Fletcher so clearly pointed out, and that parasites are our number one problem in clinical practice for me. Internal parasites, the Barber pole worm here in Western North Carolina, much of a problem that we have to deal with. So pneumonia, CL, which he covered, sore mouth or contagious eczema, the foot problems, tetanus, caprine arthritis, encephalitis, Johne's disease, not real common, but is out there. We are seeing some Johne's in goats. Of course, he covered Clostridium C and D, pink eye we do see, and then I threw in pregnancy toxemia, not really an infectious process, but you may see it in your goat herd at some point. So we'll go to the next slide. So what are some of the symptoms that we might have with an animal that has a health problem? Of course, being off feed, isolating itself, acting lethargic or lagging. You know, if you have your doe herd that you're familiar with, if you kind of call them up to give them a little feed or just to check on everybody, you typically the first ones will be in the first and the last ones will be in the last, usually kind of consistently. So if you all of a sudden notice that old Daisy that's usually out in front is lagging behind tonight, then you better be checking on her. There's probably something going on. Diarrhea, obviously a manifestation of symptom of problems. Vocalization, goats are pretty vocal, particularly when they have pain and that sort of thing going on. Grinding of the teeth is also a symptom of pain, particularly in ruminants. Next slide, please. So let's talk a little bit about normals. Body temperature for a goat would be 102 to 104 degrees Fahrenheit. Goats tend to run a little bit higher than a lot of our other domestic species. The mucous membrane should be pink and moist. The respiratory rate should be somewhere between 16 and 24 breaths per minute. Ruminations, the rumen, which is located on the left side of the animal there in that paralumbar fossa, you should be able to witness or put your hand there and feel the rumen contract 1 to 2 times per minute. Next slide. So if you're just starting out and wanting to purchase or get into a meat goat herd, you know, you want to start with a healthy herd. So where should you purchase your animals? The first thing I would say is you should purchase them from from a reputable breeder, and preferably one that's in your area and one that manages them like you do. The good thing about goats is they're pretty versatile and each farm is different. So you can visit local farms, see how they raise their goats, and see if that fits your pattern as far as the way you're going to manage your goats on your farm. You can also buy from a reputable sale, a breeding stock sale. I don't recommend that you go to your local sale barn and start your process of building a herd because you can bring home all kinds of problems. But it sometimes can be fun to try to figure out what the problems are from all those that come from the local sale barn. Next. So this little illustration here, kind of simplistic, but I think it brings to point what we're going to talk about. On the left side of the screen, we have no disease, and on the right side, we have disease, and there's a dividing line there. So we have, so one of the things we want to do is we want to try to maintain high immunity in our animals. So you can see if we maintain high immunity and we have low exposure rate, then we're less likely to have disease. But as our immunity levels start to wane and go down and our exposure rates go up to diseases, then we have disease. Next slide. So nutrition is, in my opinion, probably the most important thing as far as maintaining healthy animals. And contrary to popular belief, and I did this little experiment, goats won't eat 10 cans. And goats do require highly digestible nutrition. I've heard many people say, well, just give me the sorriest hay that you have, the poor quality hay, and we'll feed that to our goats. But that won't work. So let's move on to the next slide. So I'd like to emphasize that goats, they love buffets, and goats really love browse. I like this particular pie chart that we have here. The larger blue section indicates browse, which means vines, blackberry bushes, anything that's kind of up off the ground. Goats also eat a fair number of forbs, which we call our broadleaf weeds. And then you see the smaller part of the pie, the kind of green there is grasses and legumes. All right, next. So goats are ruminants. They're designed to forage. They selectively browse to choose the most nutritious plants available. And the thing about goats is you'll watch them and there'll be something out in the pasture that they won't eat all summer. And then when fall comes, they'll decide to eat it at the appropriate time. And that's back to browse, or these jungle areas that I like to refer to are some of the best places for goats. We can have forage based only or forage only. There's too many variables on each farm to have a cookie cutter design for what your nutrition program is. But by monitoring our body condition scores, can help you to keep up with your nutrition program. Of course, fresh, clean water is the most important nutrient. Goats just won't drink nasty, stale water, and so they like to have fresh water. Free choice salt and mineral supplement. And then at the bottom, immunity level, which is what we're talking about, is much better in a properly nourished goat. Next. So this just illustrates some of the ways that we have, in our production cycle. The top left hand is the way I like to see goats eat. It's the way God designed goats to eat, up off the ground. They're not getting exposed to Homunculus contortus up there in the trees and the vines. On the right upper is probably what most of us have available is pastures, which are easier to manage, but it exposes them to a higher degree of parasite load. And then sometime throughout the year, we're likely to have to supplement with hay and then even bagged feed at certain times. But that's how we like to manage our goat herd as we go through the production cycle. Next. So just monitoring your body condition score on a scale of 1 to 5. 1's a severely emaciated animal. 5 would be an overly fat animal, basically. So we like to maintain our herd somewhere in the 3 range there in order to maximize our performance out of them and not waste extra feed on them. Next slide. So what are some of the genetic factors that we can choose to try to keep a healthy herd? Parasite resistance, which is somewhat heritable, and as Dr. Bowdridge so clearly made clear tonight, that by choosing for parasite resistance, we're seeing that he's proving that in sheep. So we're extrapolating, and hopefully that carries over into our goat herds. But not only do we get parasite resistance, but we seem to get better immunity overall by choosing for parasite-resistant animals. Reproductive efficiency, motherability is a highly heritable trait. Udder conformation so that we can get good colostrum into those babies. Next slide. So Dr. Bowdridge talked about FOMACHA scoring. This is just something that we have to, I think, at least mention in these disease processes. We've got a nice pink mucous membrane conjunctiva on the left here and a very pale conjunctiva on the right. Next slide. Also would mention fecal egg counts. So by choosing these parasite-resistant animals, one way to really identify the truly parasite-resistant animals in your herd is by having fecal egg counts performed, either learning to do them yourself or sending them to a lab to have them done. And I think they're appropriate to be done at different stages in life cycle, maybe when heavy pregnant does, dry does, and then at the end of lactation. And it will really tell you the story as you go through the year by checking those fecal egg counts. Next slide. Reproductive efficiency, motherability, highly heritable trait. In our meat goat herds, we need to retain does that kid and wean twins year after year. Yeah, triplets are okay sometimes, but I really like to focus on those does that can have twins. They not only can birth the kids, but they get them to weaning time, and then they're available to either go on to be breeding stock or go to the meat market. We also should be keeping replacement doelings from these does that can do this year after year, and we should retain doelings from those does that kid early. What I find is that in most doe herds, you'll find year after year, there'll be a certain subset of does that kid early. Like when you put the buck in, they're going to breed early year after year, and they're going to kid early. And what we find is those offspring from those does tend to follow the same suit. So what we call doe fitness is so important because longevity in the herd, by choosing the does that can raise twins and wean twins year after year with minimal input, those are the does that I'm looking forward to keep in my herd. Next slide. Udder conformation, already mentioned some about colostrum and how important it is. The kids get all their immunity, in the first few hours of life from that colostrum, that liquid gold, I call it. So if you've got enlarged teats or bad udders, udders that are dragging the ground, and the kids have difficulty attaching to the teat shortly after birth. That impairs their ability to consume the colostrum, and no colostrum equals no kids. And insufficient or poor colostrum intake makes these kids susceptible to diarrhea and pneumonia, and they tend to be kind of poor performers throughout their life. Next slide, please. This graph just illustrates how quickly, on the left, we have percent absorbed. That's the immunoglobulins that are absorbed from the colostrum. So you can see at 24 hours after birth, only 12% of the immunoglobulins can be absorbed. So that's why it's of the utmost importance that those kids are up and nursing in less than 6 hours. All right, next slide. And this just illustrates what a good udder conformation looks like in a meat goat. We like to have her udder floor above the hocks. We like to see those teats above the hocks, and we like to see those teats kind of presented to the outside so that they're readily available for those kids to latch on whenever it's time for them to consume the colostrum. Next slide. Next slide. This illustrates on the top left, we have an older doe that has a nice acceptable udder. Then on the bottom right here, we see what I call these sweet potato teats here that large, it's hard for that 5 to 7 pound kid to get their mouth on this teat. It's so close to the ground and it's so large that they can't latch on to suckle effectively. So I think by choosing for udder conformation is so important. All right, next. So vaccination programs, kind of like insurance programs, they got to be custom designed for your operation. There's only a few vaccines that are actually approved for use in goats. And I know Dr. Fletcher covered some of those, so we'll quickly go through this. Next slide, please. So this little illustration shows you why it's important that we give booster vaccines on most vaccines, not all. But when you give the initial vaccine, then you have a rise in the antibody response. The animal responds to it, and then it starts to go down, somewhere around 2 to 3 weeks. So if you don't give that booster vaccine at that time, then that immunity can kind of continue to go down. But if you come in and give the appropriate booster, then we boost that immune response and it stays up longer in order to give protection to the animal. So always pay attention to the label so that it'll tell you when you need to use your booster vaccine. Next slide. So the CDT, which Dr. Fletcher really covered, it's the most common vaccine that's used. It is approved for use in goats. Your mature does are typically going to give it 1 month prior to kidding. Your kids are going to get it somewhere between 2 and 3 months of age, and make sure that you're giving that booster 3 to 4 weeks later. And as you may need to vaccinate 2 to 3. We used to vaccinate pretty much on a yearly basis, but there may be some need. I've talked to some experts recently, some small ruminant experts who talked about that we may need to vaccinate 2 to 3 times per year on some farms. And I too here have seen an increase, and I haven't documented a type A, but I have seen more adult animals with enterotoxemia like symptoms that, get sick, go down, and are dead within 12 hours with enterotoxemia symptoms. And I'm not sure if it's a type A or if it still could be a type C or D. So as I said, I just was in contact with some small ruminant specialists recently, and they were saying that they were actually recommending some of their herds to vaccinate for CDT 2 and 3 times per year on their adult animals. And I'm in agreement with that at this particular point. Next slide. The pneumonia vaccine is available. I'm going to be honest with you. I mean, we talk about it, we give it to the adults, and then 3 to 4 weeks later, kids, you can start at 90 days and repeat in a month. It commonly causes kids to be sore after you give it. I'm not convinced this vaccine is very helpful, and I think most small ruminant experts will agree that they don't really think it's that helpful. It doesn't typically hurt, but I'm not sure it gives a lot of protection. I think there's a lot of agreement on that. Has a meat withdrawal of 21 days, which means, if those that are not familiar with that, after you give a vaccine, the animal should not go through a slaughter channel for at least 21 days. Next slide. The sore mouth vaccine, a little bit controversial. It is approved for use. You have to check with your local veterinarian, your state, because some states won't allow it. But it can be used, and this is a live vaccine. So you need to check with your veterinarian and before you actually use this. You don't want to use it on your farm if you've never had sore mouth on your farm. Um, but it is a vaccine that can be used in sort of, if you've had an issue with it on your farm recently, you can actually vaccinate young kids. So the biggest problems that I see with sore mouth is when you have a sore mouth outbreak during kidding season, and the kids get it on their mouth, and they nurse the does, and the does get it on their teats, and the kids don't want to suckle, and the moms don't want to let them nurse either. So that can be a real disaster. But this vaccine can be helpful. But once again, if you've never had sore mouth on your farm, do not use this vaccine. Next slide. The CL that Dr. Fletcher talked about. We used to have a goat vaccine that was conditionally approved, but we don't have it any longer. I have used the sheep case back in goats. You can use it off label. The adults have initial vaccine, and then 2 weeks later, you can use it in pregnant does about a month prior to kidding. And you can use it on kids too. And as Dr. Fletcher alluded to, it may cause a positive CL testing on current test. And there are other vaccines that some people use for goats, but these kind of cover the most commonly used ones that we have available. Next slide. So what are the factors that influence the immune response? All vaccines are labeled for use in the healthy animals. And, the vitality, the immune system, if it's fighting something, if you're vaccinating in the face of an outbreak, oftentimes they can't fight off the disease. Stress in goats is so important. What stresses a goat? Overcrowding, weaning, weather changes, transport from long distances, gestation, lactation, any kind of change that comes on quickly can really stress goats. And what I find with goats is that often the stressor comes, and sometimes you see an acute phase stress where an animal gets sick, but it seems that stress lasts a fairly long time in goats, and it can suppress their immune system for quite some time. Next slide. So just a little bit on injections where we're giving our vaccines, and in color here on the left, you see the green and the little purple down under the armpit there. That's the places where we're typically given vaccinations or injections. And on the right side, we have kind of red and a slash mark. We are raising meat goats, so we would prefer not to give any injections into this area, because that's where a lot of our meat comes from. And follow the vaccine label. It is a legal document for dosage and frequency and handling. Use appropriate needle size. And one thing, never insert a used needle back into the vaccine bottle. And yes, you should be using a new needle each time for each animal, because we can spread some diseases. And don't forget your booster vaccines, as we already alluded to. Next slide. All right, factors that influence the exposure rate of diseases. Sanitation, cleanliness is next to godliness. Concentration, animals per unit of space. What does that mean? Well, I tell folks with goat herds all the time, I get phone calls and people say, you know what, Doc, I've been going along for several years and I've never had any problems at all. And now I've got this, and I've got this, and I've got that. The first question I have for those people is, how much area do you have, and how many animals are you running on that space? I always tell people that goats will tell you when they become overcrowded, and you'll start having a lot more of these diseases. So keep an eye on that. So biosecurity, what's on the other side of the fence stays there. Yes, try to keep, if people are coming to your farm, they should wear booties. And you want to try to keep biosecurity as high as possible because a lot of these things you can bring on your shoes, bacteria from CL to a lot of different disease organisms. So we want to make sure that we're having biosecurity there. Recovered animals that can affect others. insect control, flies and ticks and those sort of things. And a quarantine sick animals and new additions. You should have a quarantine area. And next slide. So quarantine, if you're bringing in new additions, I think you should have at least a 30-day quarantine period that's away from the herd. They should be tended to last. It's preferably a dry lot situations. And when you bring in new additions, you should perform fecal egg counts. I think you should deworm them with 3 classes of the dewormers, and you should repeat a fecal egg count in 10 to 14 days. We're striving for a fecal egg count of 0. We don't want to bring someone's resistant parasites onto our farm if we can help it. Also consider disease testing for CAE, Johne's, and possibly CL. Once they've acclimated, you can administer any needed vaccines at that time and provide some good quality nutrition, but you don't want to bring a new animal home and just to dump out a big load of concentrated feed if you don't know what they're used to. So you kind of got to make that transition gradual. Next slide. Antibiotics, we all have to use antibiotics at some point in time, and hopefully you can make most of them are off label. So you do need a veterinarian to try to help you with that, both for prescriptions and that sort of thing. Put in here FARED, which is available. Anybody can call FARED or send them if you've given an antibiotic to an animal and you don't know what the withdrawal time is before it can go to slaughter, they won't come and get you. They're not the drug police, but they will try to give you guidance, and that is available to anyone. Next slide. Do you need a veterinarian? It's all important these days with the limited available of antibiotics and things that are drugs. You need a client veterinarian patient relationship. But I'd say to observe your animals, give the veterinarian the best information you can, take temperatures, schedule regular visits. Next slide. Better management equals better health equals better profits. And the keys to success, I think, are nutrition, number one, looking for the genetic factors that we can choose from, such as parasite resistance, udder conformation, motherability, get your vaccination program together, have good husbandry, be observant, and spend time with your goats so that you can know what's going on. All right, I think that's a whirlwind fast.
All right, it is time. We're going to put up a quick poll real quick for everybody to go and complete. It's not very exhaustive. And so I do recommend, as y'all do this, hang around for a few minutes. I know several of y'all will have questions. We'll also have information about where you can find the recordings related to this. We'll give y'all a few minutes to go and complete the poll.
And while you're working on that, if you think of any questions you want to type in the chat, feel free to do so. Or here in a second, you can unmute yourself and ask them that way.
Hey, Brandon, I got to say, it's pretty interesting to see a bunch of people on here from California. Since it's my native state, it's good seeing some more Californians getting involved in this.
Yeah, I was doing some counting of where people were from, and I think we had on here today, I wrote it down, 3 countries. See, 22 counties here in North Carolina were represented. a total of 19 states, and we have people in here from several other countries. So it's always impressive when we have people from all over getting on here.
We did get a question in the chat related to fecal egg counts. What were the ranges for low, mid, and high fecal egg counts in that study?
So in that study, what we're doing is we're looking at fecal egg count breeding values and not their actual fecal egg counts. So what we have on those ones, the low ones would be less than -50. So they'd have and these are on Katahdin sheep. So they would have a fecal egg count of less than -50. So -50 to -100, that's the max lowest fecal egg count. Then we go from -50 to +50, and then anything greater than +50 would be the high side.
And then we did get a question related to CAE. Maybe this is a Dr. Brown question. What is the likelihood of CAE being transferred from AI breeding from frozen semen?
Yes, to my understanding, it is pretty low at this particular juncture. I still think there's some things that we don't know about it per se, but everybody that I've talked to seem to think that it's pretty low as far as that goes.
We had another question on here. Had a goat with a stiff neck which died. Is this listeriosis? And what can you do for it?
Well, I guess a stiff neck could potentially refer to any one of the neurologic things that we see in goats. Listeriosis would be one of those. Polio would be another one. So listeriosis, to try to treat listeriosis, typically if you catch it early, sometimes you can treat it with antibiotics such as LA-200 or those kinds of things. But you typically end up getting listeriosis through contaminated wet type feeds. I mean, it commonly comes through like silage type things, or I think really damp hay areas. It can be picked up through that. But a lot of the times when we have neurologic signs in goats, we often are treating for listeria because they can overlap a lot, or meningeal worm, or polio. So I don't know if that partially answers the question.
All right, we've got another question here. I've heard that CD&T should be given within 3 days of birth to lambs, and then 2 to 3 weeks for the booster. I've also heard that if you give it too early, it's not effective. What would you recommend giving CDT to new lambs?
You want me to answer that? Or is Dr. Fletcher still with us?
Yeah, I'm still here. It doesn't matter. I can take a stab at it. So that's kind of a loaded question, maybe, in my opinion. So it's a lot of factors there. So if you've got your mamas, whether it's does or ewes, if you give pre-lambing or pre-kidding vaccines, then and there's a lot of ifs and ands. If those lambs or kids got good quality and quantity colostrum, then theoretically they should be protected. So now I have had situations where lambs were dying, and I did back up and maybe did give that vaccine or had them give it within the first week of life. So it's a lot of variables there to consider, but typically if you've got lambing and kidding vaccines in those mamas, then you should be okay to wait to that 4 to 6 week mark to do your first initial primary dose vaccines on those lambs and kids.
All right. And there's a question in here about rotational grazing. And I know we have one of our webinars that we got coming up is based on rotational grazing and grazing management. But Dr. Bowdridge, I'll shoot this one to you. How long should a pasture be rested for reducing concerns about parasites before reintroducing animals?
Depends on where you're at. I mean, that's in the time of year. I mean, that there's a lot of difference between how you'd graze in North Carolina than you would in Central California. So it's a really, really tough question to give anybody a broad stroke recommendation on the minimum time that's needed. It really depends on what your grass growth is like, the rainfall that's going, your grass production that's going out on your pastures. I think one of the biggest things that we can do with, I worry less about rest periods between those animals or between those pastures, and more about making sure that the pastures and the grazing animals have enough nutrients to perform the way you'd like them to. So if that means that you need to supplement a little bit, then that's what you have to do, depending on your environment. I mean, it's even different from North Carolina up here in West Virginia. So what you guys are doing in the summer compared to what we're doing in the summer, you may have a longer rest period just because it's hotter and drier, where we can get away with a 30-day rest period. So it's highly environmentally dependent and just location differences, where I can't give a broad stroke. This is, you have to rest them 60 days no matter where you're at. Sorry that I don't have a clear-cut answer for you, but I'm a university professor. That's our job.
All right. And this question goes to any of you. What would be the protocol about buying a herd of goat or sheep from auction? I've lost 5 to 10% of goats from auctions each time.
That's another loaded question, I guess. So I would say if at all possible, don't do it. So would be my initial response. However, it depends on what you're losing those goats from. So work with your veterinarian to determine why they're dying, whether it be parasites or pneumonia. And then if say it's pneumonia, then maybe work with your veterinarian again to get a vaccination program going and some sort of preventative measures in place there.
I think in this case, intake protocols are really critical. I run one of the largest goat tests in the country. I've got 200 plus goats coming from 17 different states across the US, and that's a nightmare for us to worry about other people's goats that are coming here to get tested, and I don't want them dying throughout the entire test, but I certainly don't want a bunch of them dying. 5 to 10% of them, losing them in the first few weeks would be disastrous. So some of the things that we do is we go through there and give them a lot of vaccinations. So when those goats arrive, they get treated much like little infants that are born. They are smacked around, they're ear tagged, they're getting every different shot that we can do that. And if you're continuing to buy animals from auction yards or any of these different sales, you have to consider that those animals may be bringing in something that's foreign to your particular location. So a good quarantine protocol, an intake protocol, work with your veterinarian to find that kind of combination of vaccinations and maybe some prophylactic antibiotics that are going into those animals prior to the time that they're being reintroduced to the rest of your herd or flock is critical if you're continuing to buy animals and bringing them in.
Dr. Brown, everybody else has touched on that. You got anything to add?
I would say just making your transition as smooth as possible by slowly introducing feed. It depends on, I don't know if you're buying young stuff or older stuff, but starting with very quality, some quality hay, depending on how old they are. And, yes, doing, vaccinations, but being observant because a lot of times animals that are going through the sale barn, a lot of them have problems going into the sale barn. And so you get them home. And then, so of course, the weakest of the 5% that you bought, yes, they die off because they were headed downward anyhow. So I guess just going over them really good, doing your FOMACHA scores as soon as you bring them home to look to see if they are carrying parasite loads as best you can tell by that, and easing them into your transition onto your feeding program easily. And I would try to minimalize a lot of the handling too as you bring them in, at least for the short term. Give them a little time to settle. I know we want to bring them home. We got our hands on them right then. We want to run through and do a lot of things to them. But I think if you've got a time for them to have a few days settling actually before you handle them, might be something helpful also.
All right, that was a good question. Real quick, we got a few more questions in here. I do want to point everybody to the chat box. Dr. Andrew Weaver had put the link where you'll be able to find the recordings. And so he's got the link down there. It also has all the recordings from our webinar series last year, which also has a lot of the same information on there, but maybe different topics, and it's always good to be able to go back and watch those. We're also going to send a link to the recording back out through Eventbrite. So just wanted to point everybody to that. If you want to go ahead and copy that link right there and take a look around there, we highly recommend that. Let's see, what other questions do we have? I've seen people who raise sheep and boast they've never had to trim feet and haven't trimmed a hoof in so many years. Is this actually a good practice and a good thing to strive for, or is it better to routinely trim to keep ahead of hoof issues?
So I grew up in the desert of Southern California, and I can't remember sheep that we had to trim sheep hooves on, just because it was dry, right? So, in this part of the country, so I've sheared sheep from Maine to North Carolina to all over California, and I've seen foot rot everywhere. So I'm not sure that any of these disease problems is it the goal to strive for sterility. I think that might be just a fool's errand to do that. But I think that what you can do is to manage that incidence of disease, removing wet areas and low-lying areas, keeping sheep out of mud, keeping goats and sheep out of muddy areas that have a lot of low-lying water. And then I'm always reminded by some of the stuff that came from an old professor at Ohio State. Dr. Parker would say that foot rot's probably the most expensive disease that you'll ever purchase. So making sure that those sheep that are coming in are clean of that and have time to shed that organism before they get out into your pastures. So I'm sure that Dr. Brown and Dr. Fletcher have a different take on that, just from the clinical side of everything. But from the management side, I really think that that's what controls that disease probably more than anything else.
Yeah, I would agree with that. And those that sometimes say they don't have an issue just aren't looking either. So, I found a lot of back window farmers where they look out the window and to diagnose something. So that's another issue.
All right. This is a little off topic, but I'm newer to Kiko goat farming and haven't heard about the West Virginia buck testing, and was wondering what they need to do to be able to send a goat in for that test.
I usually don't talk about the test until the new year rolls around. That pretty much sucks a good portion of my life away during the summertime. So there'll be there's a Facebook page for the West Virginia buck test. And it will be posted through the Kiko Goat or through the NKR and the other Kiko Goat Association. There'll be a lot of advertising. about the things that you need to do. Your goats need to be born between January 1st and March 15th. So those are the big kind of things. And then making sure that those bucks, before they arrive here, weigh 40 pounds. I'll send them right home with you. You drive all the way up there. I had a guy drive up here from Alabama and turn them around and send them home. So making sure that they're in good shape and that you're doing the testing for the right reasons, I guess is the other thing. I think performance tests are a valuable tool in evaluating animals' performance in a mixed group of livestock, but think about your sire structure. Think about what you're going to do with the data that you're getting back, and use it more as a tool to help your selection as opposed to a contest to win. So that's just my 2 cents on that. I'll take your money. I have no problem doing that. But, the better the goats are prepared coming to the test, the more likely they are to make it through the test all the way and actually give a good representation of what you're doing on your own farm.
I had a question for Dr. Bowdridge. Last few producer meetings I've been to, I've been asked about this new product called Biowarma. Are you familiar with that? And have you had any experience with it?
I don't have any experience, but I'm around a bunch of scientists that use it and are the folks that did a lot of the research to get the product approved. Basically, it's a feed-through fungus that as the fungus develops in the fecal pat, the fungal spores develop, and those fungi hold the larvae in place, so they don't allow them to migrate. And by holding them in place, they'll die out eventually, but they can't migrate anywhere. So that's the advantage to that. There's some mixed results, and Dr. Weaver can talk about this a little bit too, in terms of the viability of the new strains that are coming out. You got to watch the shelf life on that stuff really closely. And if those spores are only active for so long, and there's a lot of research going on right now about how to deal with that and how frequently we need to be doing this in different operations. So remember, it's typically been done in kind of a scientific setting and doing this on pasture. There is a ton of information about Biowarma and Livamol that's available through the American Consortium for Small Ruminant Parasite Control's website, which is wormex.info. And you can go on there and get a lot more information than I have on that particular product and how you might go about using it effectively on your farm.
All right. See, I saw one up here about acorns. Lots of acorns in my area, in an area of my pasture this year here in North Carolina. My sheep love eating them. Do I need to isolate this part of the pasture to control their intake, or just let them graze as they please?
So acorns have a lot of tannins in them, and tannins really like to bind protein and make it undigestible. So if you're feeding goats or sheep too much acorns, you can actually create a condition in them that where they're deficient in protein. So you got to be real careful with acorn consumption. They can have a few here and there, but it can't be a large constituent of their diet. So in Northern California, where my parents run a bunch of sheep, there's a ton of valley oaks through there, and there's a lot of acorns on the ground. We usually those areas with a lot of acorns don't grow a lot of grass. And that just might be the situation that they're at in Northern California. But in other places, I usually try to avoid grazing those areas that have a lot of acorns, just because of the hypoproteinemia that can happen. Dr. Brown, you can chime in, or anybody else. That's my 2 cents.
Yeah, I know goats seem to love them, eat them up. I don't know that I have seen clinical acorn toxicity in small ruminants per se. I have seen it in some cattle, I think, in the past. But I know eating a few of them, as Dr. Bowdridge said, I don't think it's going to be a problem for them. And in general, I have not seen acorn toxicity in small ruminants, but I'm sure it does occur. But if you're just if that's kind of all they have available to eat, you kind of got to look at the whole picture again. What else is available for them to eat? How often are they frequenting those areas, and that kind of thing.
Right.
There's a question about meningeal worms. I don't think we've touched on that yet tonight. What are your thoughts on that?
Well, I guess meningeal worm, as far as the life cycle is kind of interesting in the meningeal worm. The meningeal worm, P. tenuis, is carried by the white-tailed deer, is the host of it, but it doesn't seem to affect the white-tailed deer. So the way it gets transmitted is through the intermediate host, the slugs that carry the larval stage. And a common way that you see this, I mean, in North Carolina, obviously or on the East Coast, we have white-tailed deer everywhere. And so a common scenario is you have a brand new pasture that you have um, just completed, and there may be a browse bramble area, and you put your goats on there for the first time, and then a few weeks later you end up with neurologic signs. A lot of times the first sign will be weakness in the rear limbs, and then often can go down with neurologic symptoms. And so, there's not much way you can really prevent the ingestion of these slugs. And these slugs are not always just in the most wet areas either. They're some of the, I guess what they call the terrestrial slugs that are up on the ground. The slime actually contains the parasite larva too. So, but it migrates, it gets into the goat or other small ruminant typically, and then it's in an aberrant host, and it ends up migrating through the tissues of the spinal cord or the brain, and can show up anywhere. And then the treatment, if you catch them early, it can be treated. It's usually a combination of high doses of something like ivermectin and Panacur or fenbendazole, along with sometimes steroids or Banamine. But meningeal worm is out there, and it will show itself if you got white-tailed deer around.
Andrew, I'm not seeing any other questions that we haven't hit some part of. Here's one last question to end on. Recommendation to evaluate sheep when buying private treaty. What should I look for if I buy a starter flock off of Craigslist or Facebook Marketplace?
Well, I guess for me, if that's the route that you want to go, I would, once again, I would say try to find a reputable breeder in your area that's going to manage them the way you do. But if you're going to buy a starter herd off of Facebook Marketplace or that kind of thing, you're going to take that plunge, then I think you got to put your hands on the animals. You got to look at those animals, see how they're managed. It's not going to meet up at the local Lowe's parking lot and transfer the sheep or whatever. I'd be wanting to go onto the farm and see how they've been managed, and see what the parents look like if you can. But that's always a difficult thing to do if you're buying a starter herd like that. I mean, I think you're really better off to back off, take time to find someone in your area that's raising the animals that you're looking for, and ask them, can I spend some time with you, and take a deep breath and go talk with them and see if you can do that versus just buying a starter herd from somebody off Facebook Marketplace. I'm sorry, but I just think that's worth your time to wait.
I would agree with everything that Fred said. I think it's dangerous. You're just setting yourself up for some problems that unfortunately you're going to pay quite a bit of money for, have the opportunity to pay a lot of money for. And the more insurance against a bad decision that you can get, the better off. And the more information that you get is just more insurance against a bad decision. So ask a lot of questions, spend a lot of time, do a lot of research. You've got extension faculty and personnel in your county and your state that are paid by your tax dollars to assist you in these decisions. And that's what we're here for. So if you're in North Carolina, give Andrew Weaver a call. If you're in Virginia, Scott Greiner's your guy. I mean, we're all searchable and we're all available to answer those questions for you.
I might add records. So you know, I'm not saying that everybody that posts animals for sale is you know, going to be a bad deal on Facebook or wherever else, but ask them to see records. So if they're doing a good job, you know, they've got records, and I guess pursue it that way. But I agree with both Dr. Bowdridge and Dr. Brown. You know, find a reputable breeder and work with your extension agents for sure.
I think one last thing before we go, if you're looking at doing fecal A counts, either doing them yourself or having a veterinarian do them, I think those are valuable things. If you go to that wormex.info site, you'll also find 3 locations throughout the country that perform low-cost fecal A counts. So at my institution at WVU, at Texas A&M, and Virginia Tech, we've all kind of gotten together and kept those fecal A count costs low. Virginia Tech is $6 a sample, A&M is $5, and at my university it's $5 per sample. So we usually turn that around pretty quick as well. So there's some options for you. Instead of you having to do them yourself, you can rely on somebody else to do it for you.
All right, and with that, I think that's a good stopping place for us tonight. I would like to thank everybody for getting on, jumping on here. I thoroughly encourage everybody to continue to watch the webinars through the webinar series. You'll get that link sent to you. We appreciate Dr. Scott Bowdridge from West Virginia, Dr. Chris Fletcher with Virginia Department of Ag, and then Dr. Fred Brown with vet there in Elkin, North Carolina. I appreciate all 3 of them getting on. They, 3 great resources. If you have any more questions related to
there's a birthday question that we should answer, and I think that would be excellent for Dr. Brown to answer about feeding a goat birthday cake on their birthday. And is that an okay thing to do?
So the question is it okay to feed your goat birthday cake on the goat's birthday?
On its birthday, yes.
On its birthday. Well, probably not necessarily all that great, but I guess if you're that close to your goat that you can fix a birthday cake for it, I would not be one to stand in the way of that.
I think maybe a piece is okay, but not the whole cake. But I wanted to make sure that we touched on that. Thank you, guys.
Real quick, our next webinar is January 16th. I would like to, if you have any more burning questions, reach out to your local extension agent, reach out to the small ruminant specialist in your state or a surrounding state, and definitely rely on your local extension service for any more information as a way to move forward. So we appreciate everybody getting on tonight, and we're going to go ahead and close things down. Thank y'all for joining.
Thank you.